and I am on the board for Miles4Hips, and I'm going to read this, a lot of it, because I didn't get the chance to memorize it, so no judgment, please. Good morning, and thank you so much for coming out today to Move in the name for Miles4Hips on the International Day of Movement, our first one.
Woo!
There are groups like this gathered from the UK to San Diego to Australia. We are just one piece of a larger movement. Raise your hand if you have hip dysplasia. Yes. So you can tell that this is a cause that's near and dear to a lot of people that are here today with us. I'm going to start out with just kind of explaining what it is for people who are just not really familiar. What is a hip? What is a hip? It's where your leg connects to your pelvis, so it's the largest ball and socket joint in your body. What is hip dysplasia? So I like to explain it as a sombrero versus a beret. So people with hip dysplasia have berets kind of just like on the side of their head. It's really cute, but it's not great. Normal hips have a sombrero straight on the middle of their head, where it's fully covering their head. So it's not a good situation. It's also called shallow sockets.
And you can't get rid of it.
You can't, well, you can. It causes hip instability, muscle dysfunction, and increased joint deterioration if it's not addressed in childhood. If you're familiar with human dysplasia, I know, dogs too. You typically think of it as a baby condition. Every baby is examined for signs of clicky hips at multiple points in their first year because it can be congenital at birth or developmental, acquired after birth. Risk factors include being a female, being the firstborn, breech presentation, and family history. Babies with 2 or more of these risk factors should be further assessed by a hip specialist. 1 in 100 babies are treated for hip dysplasia with bracing and casts, so it's fairly common. If identified and addressed early, many cases are resolved in childhood. For those with unresolved or undiagnosed hip dysplasia, symptoms typically begin during the busy early adult years. People are in college. Young adults are beginning careers. Women are having babies. Parents are raising young children. These people aren't home with mom and dad with loads of TLC and no responsibility. It happens when you are attempting to fly solo or when you might have dependents of your own. No matter the situation, it doesn't happen at an ideal time of life, and the fix is not easy at this point. Symptoms include mild to severe groin, lower back, leg pain due to that instability from the beret, joint damage, and muscle dysfunction. Most wait years and see many doctors for an accurate diagnosis, so they suffer for a really long time. Invasive joint preservation or total hip replacement surgery is needed, and both entail lengthy recovery and rehab. Even after surgery, continuous therapy is needed to maintain functional hips. I was one of the lucky ones that was diagnosed and treated in infancy, but unfortunately, even with caring, attentive parents, my hip dysplasia was not fully addressed and resolved. Like it does for many, pain started in my early teen years. It was diagnosed as stress fractures or arthritis due to high impact Irish dance and running. No one ever looked at my hips. I learned to live with pain and considered it normal for nearly 20 years until the birth of my second child. Through her hip dysplasia screening, I was re-diagnosed and underwent 3 joint preservation surgeries, and I am in continuous therapy to get back to being and maintaining functionality. My story is not unique. This has been such a life-changing journey for me. Through my struggle and associated learnings, I knew I had to find a way to pay it forward. Miles4Hips was born on a beautiful hike in the mountains of Utah with a fellow hip dysplasia warrior, Nancy. We discussed at length that there was a gap between patients and the medical community. An unbiased source of information, community, and support was needed over and above casual social media groups. This is when Miles4Hips was born. Miles4Hips is a patient-driven collaborative initiative between individuals affected by hip dysplasia and the International Hip Dysplasia Institute, IHDI. The IHDI is the global leader in educational, research, and technological initiatives aimed at preservation, early diagnosis, and innovative treatment options to minimize the long-term impacts of hip dysplasia for infants, children, adolescents, and adults. Miles4Hips is dedicated to raising awareness of adolescent and adult hip dysplasia, supporting the IHDI, providing non-expert educational material, and promoting the enjoyment of movement for healthy hips and minds. 100% of the funds we raise go directly to the IHDI. Now, after all of that, thanks for coming out today, and let's move.